Yeah, so I'm afraid, yes, it is it's a frightening statistic, and I'm afraid this will continue for a while as we go through the second wave, as some people would call it, or our resurgence.
Hmm.
And really, the consequences are, or the reasons for the deaths are essentially what we have primarily been seeing in the first wave or first surge. In that, it's really the older age groups, the groups with comorbidities such as respiratory diseases, hypertension, cardiac disease,
Hmm.
and so on. So I'm afraid, and diabetes as well is really an important contributor. So I'm afraid it's that span of groups that we saw in that first wave that we currently are seeing now in the resurgence that are contributing to the numbers of deaths. And as you can see that the numbers of actually infected individuals has also markedly increased. And so as a proportion of that, we're seeing that proportion going through our hospitals in terms of ending up in our high care, ICU, and unfortunately succumbing to the disease.
Yeah. What about young people, Professor? What is that picture looking like right at the beginning of this COVID-19 outbreak in the country? Young people were seen as much more resistant, particularly when it comes to the death rate.
Yes, there are ongoing studies, and as you know, this is probably going to be linked to the understanding around what this new lineage is contributing to what we're seeing in terms of the outbreak.
Mm.
So I think the concern still is that this particular variant may lead to a more severe disease outcome, may affect younger people more severely.
Mm.
But at this particular point, I don't think there's really good evidence to show that this particular lineage, or at least what we're seeing, is behaving any differently to what we're seeing in the first surge. So I think we need to still be cautious around that. I know that people have anecdotally reported that there's greater severity
Mm.
of disease, and in particular in the young. But at this moment, when we're looking at our data currently, we don't see that occurring. But I'm sure that with further analysis, further refinement of that analysis, we'll certainly see whether that is the case or not. But currently, there's no real evidence that that is the case.
Yeah, I'm glad you raised the issue of the variant, Professor, because some people are saying that, especially those who've contracted this virus in this second wave, they're talking about a more severe symptoms that they are experiencing. Could that be the leading cause of the deaths that we are seeing? Or is that something that's yet to be confirmed? Because there wasn't clarity about how severe this is. Investigations were still ongoing as to the severity of this variant.
Yeah, it's really a complex matter. I think, and I know we would like to have some early answers to that particular question, just as is the case in the UK. So I think we need to be cautious that there may be a combination of events, combination of this variant plus the movement, the geographic movement, and all these factors coming together, leading to this rather what we almost seeing an explosive outbreak, and that started in the Eastern Cape, followed by the Western Cape, and then now KwaZulu-Natal,
Mm.
to an extent in Gauteng. So I think we just need to be cautious that because when you look at the virus from a molecular perspective, there may well be the possibility that this could lead to increased transmissibility. But I think until the necessary experimental work has been done, until the molecular epidemiological studies have been done, I think we just need to be cautious that we don't conflate these particular events leading to the specific outcomes. I think many people are tending towards that,
Mm.
but I think we just need to still be cautious.
Prof, I know that this may be an area you will be cautious in commenting around, but talking about the Eastern Cape, and that's where this new variant showed itself, and it appears that it's causing a lot of death there. That province is leading in terms of the number of people who are dying from this virus. I was reading an article where the government's special COVID-19 advisor to that province, that's Dr. Bevan Kokwana, he was quoted as saying, ignorance from people, lack of oxygen, and a shortage of ICU beds, both in the public and private hospitals, they seem to be identified as the leading cause or causes of death. Do you concur?
Well, I think those are important points that have been raised. So again, if people are ill and present late, for example, then that will certainly be a contributor. It's also really critical, and we've seen anecdotal reports within the newspapers about the fragility of the health services. So it's really important to understand, again, around what is the nature of the infrastructure, the nature of the staffing, the nature of key supplies, such as oxygen, for example. Are these also contributors to the fact that the healthcare is not to the optimum levels that are required? So those points are very important, and I'm sure provincial and national departments of health are really carefully looking at that. We know that there are facility readiness committees across the country who look at these things very carefully on a daily basis. And in order for us to respond to those very key things, such as, are there problems with the oxygen supply? Is it reaching the hospitals on time? Are they being replaced on time? So those are really important key contributors, because the management of COVID has certainly improved over the few months that we've had this particular outbreak. So we are hoping that that is not the problem. The problem then comes to the fact that maybe, yes, there may well be problems with regard to supply.
Yeah.
But coming back to the broader picture, you're quite right. We've seen, as we've moved to level 1, that in fact this allowed for greater movements of people. This allowed for, I suppose, super spreader events to occur. Our ability not to comply, or our inability to comply with so-called non-pharmaceutical interventions such as physical distancing, the hand hygiene, the wearing of masks, which are all key contributors to preventing transmission, those may have ebbed away and leading to us becoming more risk, or having more risk of actually acquiring infection, leading to the events that we're currently are seeing.
Professor, the issue of anecdotal evidence, it's very important, because these are people's lived experiences with the health system in particular. I want to focus the attention on the Eastern Cape for a little bit. The article I was reading was from the Daily Dispatch newspaper. It's a local newspaper in the Eastern Cape. And there, Dr. Goqwana, the very special advisor I'm talking about, he was telling this newspaper that a patient who was being transported from a rural part of the Eastern Cape, it's a vastly rural province, as you will understand, that patient was being rushed to hospital and they died in an ambulance whilst still being rushed to hospital. Why? Because the ambulance did not have oxygen. What's your assessment of that province's capability in terms of the health system being able to handle this? Is the Eastern Cape, I don't think there's any doubt that the Eastern Cape is under pressure, but do you think that the healthcare system there is quite literally collapsing?
Yes, I'm afraid I'm not in that position, I'm afraid, because we don't really deal with those types of key areas around, for example, transportation, around oxygen supplies and so forth. I think, but it does raise those questions. And I think the Minister of Health has been acutely aware and has actually been working with provinces to really try and understand what are the challenges? Are the challenges of the very ones that you have raised? I think, we can also add to that the fact that healthcare workers are also becoming infected, leading to a decrease in the numbers of staffing available, the questions around availability of PPE. So those are, yes, I agree with you, very key questions that I think the departments of health need to answer and be aware on a daily basis as to what is actually happening and how to address those problems. Because you're quite right, it is about people's lives and losing them. Are we losing them unnecessarily because we don't have within our armamentarium all the necessary requirements, and how do we address that?
Yeah.
But I also come back to the point that you're raising, a very important critical point, but it also comes back to our communities and understanding, if we continue this way in terms of allowing continued transmission, then those are the consequences that our families, our mothers, our aunts, husbands and wives are going to be severely compromised if they have, for example, are they in the older age groups?
Yeah.
Are there comorbidities? These are all, as you said, this all leads to this really deadly cocktail
Yeah.
of the events that we're currently seeing.
Professor, very briefly for me, my last question to you, it's something quite fascinating that I read from the Daily Dispatch. The article talks about some people, I'm not sure whether it's families or communities, that are engaged in this practice. Some people are quite literally exhuming the bodies of people who've died of COVID-19, and what is being removed is the leak-proof plastic body bag that the people, unfortunately, who've succumbed to this virus have got to be buried in order to protect those who, I guess, will be attending the funeral. Remind us again, Professor, you're a scientist here. Remind us again the importance of why these people, when they are buried, they have got to be sealed with these plastic bags. What is the importance around these plastic body bags, and why should they not be removed?
Yeah, so I think it's really key. We talk about exposures and the types of exposures, especially to body fluids and so forth. So again, if there's an expulsion in that particular body of particular areas coming into contact with that particular body, the risks may well be there. So it's really important that I understand that we have various rituals that we go through, and it's really trying to understand that this virus is a very deadly virus. It's transmitted through, close contact with, for example, aerosols and so on. So I think it's really critical that even though this is really painful for us, that we try and adapt to these particular rituals. And I think it's all about coming back to communication with our communities, saying that the reasons or the rationale for this is to try and protect you. It's not about changing our culture and so forth. It has been changed to a very large extent. We never used to wear masks as a routine. I think it comes back to really engaging with communities at that level to really make sure they really comprehend and understand the reasons for why we do these particular actions. They're not meant to dehumanize, even though it comes across as that. It's not meant to undermine our cultural activities, but it's really around, under these circumstances, we really need to think about how to protect ourselves as individuals and in our community against becoming infected.
Professor Adrian Puren, thank you very much for your insights.